Hello, my name is Dr. Craig Owen. I'm a senior lecturer in psychology at Anglo-Ruskin University. This Pecha Kucha presentation is entitled Lads, Medical Experts and Carers, How Men Talk About Penis Concerns in Online Forums. In 2018, a colleague and I asked the question, how do men's magazines talk about penises? We analysed articles in 4 of the UK's best-selling men's magazines. We observed that constructions of masculinity have shifted and changed, but the central role of the penis has remained firm. We concluded that magazines create fear-ridden spaces where men are bombarded with unachievable masculine ideals related to the penis and traumatic examples of mutilated members. Men using these magazines as a guide to manage penis problems were being taught to be afraid. The present research moves from looking at media representations and asks how men themselves discuss their own and others' penis problems. Do men talk about their penises in similarly severe ways, or do they treat them more tenderly? Of course, when men talk about their penises, they are discussing more than just the fleshy appendage. Penises are maleness made flesh. They are bound up with masculinity, to the extent that the very word manhood is synonymous with both the penis and masculinity. Fear of being perceived as not man enough is a common component of Western heterosexual masculinity. Sex and the penis are where many of those fears are rooted. Researchers note that anonymity offered in online forums can enable more expansive expressions of masculinity, help-seeking, and vulnerability. Thus, the aim of our research was to explore to what extent men in a sex-positive online forum reproduce traditional or alternative discourses of masculinity. Reddit is one of the largest forums on the internet and was the obvious site for research. Reddit is divided into subreddits, groups of users focused on distinct topics. Members, known as Redditors, create an initial post, and members of the subreddit direct their replies to the original poster and to each other. We collated data from the sex-positive subreddit rsex. Using the search terms penis, cock, and dick, we collated 240 data extracts, consisting of 22 original posts. Original posts were short stories based on personal experience, culminating with a request for advice. To analyze the posts, we employed discourse analysis. We identified 3 equally prominent discourses. 2 of the discourses resonated strongly with findings from our previous study, and we reused the labels laddish and medicalized. In the 3rd discourse, which was not evident in our previous study, we labeled caring. Posts where laddish discourse predominated focused on traumatizing tales of disfigured or painful penises. Have you guys ever had that thing where you're fucking and then your dick misses and it gets crushed? Ouch. I'm 16 and this happened to me for the first time today. How often does this happen to you guys? Can it do possible damage? Rather than genuinely engaging with the poster's concerns, laddish responses downplayed their experiences and engaged in enthusiastic one-upmanship by saying it could be so much worse. These responses worked to simultaneously reassure original posters while promoting further anxiety. Just wait till she starts doing that reverse cowgirl and does some weird bear trap twerk shit on your dick with the full weight of her hips and her body. Sure, might feel good on you, honey, but my cock's over there snapped in half from that little maneuver. In the medicalized discourse, penis problems and solutions were discussed in more serious and ostensibly scientific ways. Posters understood these problems as their own personal failures, typically related to the malfunctioning of their penis, and practical solutions were requested. I have premature ejaculation. The one time I did last a long time without alcohol, it was with a stripper, and she gave me head first. The other times I tried the purple numb condoms, the lidocaine spray, they didn't work. One of y'all tell me what to do. Like, as soon as I try and push it in, I can feel myself about to burst. I need practical solutions. In response, Redditors took the role of expert sex instructors, offering practical, pedagogical, and consumerist advice. Endurance training and edging. Start now. Don't quit till Friday and you can achieve your dreams. You could also get a script of Viagra. Masturbate more often. Before sex, drink a couple of beers and smoke cigarettes. In the caring discourse, posters shared penis problems associated with deep-seated psychological and emotional insecurities. Last year, my ex sent me a Snapchat of her being fucked by a guy who was way bigger than me. Now my sex drive is non-existent. I just started sex therapy. How do I fix my sex drive? The responses were typically serious and sincere, offering empathy, encouragement, and validation, akin to the type of support offered by a therapist. You are better than this. You are worth more than this. You have more value than you believe. You are a valuable person who deserves pleasure and peace. That's terrible. I'm sorry that happened to you. It's awesome you're in therapy. That should really help. It's also important to remember that our sexuality is always changing. Sometimes people have low sex drives for weeks, months, or years, and then things shift back to normal at any time. And the therapy should really put you on the right path. A broad view of our findings indicates that none of the three discourses were dominant, and they sat comfortably alongside each other. This pick and mix of discourses gives men different ways of expressing their masculinity and managing their vulnerabilities. Healthcare professionals recognize that men are reluctant to seek out professional help for their panoply of penis problems. Spaces like Reddit offer a haven for men to share their vulnerabilities. Advice and support on online forums offer a diversity of opinions and tone, something that medical professionals don't provide. Health professionals should draw insights from online spaces about how to talk to men about penis problems, thus increasing men's engagements with health services and promoting better sexual and mental health outcomes. Ultimately, spaces are needed where men can feel as comfortable to discuss these issues with trained professionals as they do with Redditors with names like Mr. Big Dick 69.